18 tips for postpartum care. 1. Promote ambulation. After vaginal delivery, mothers should try to walk. Be careful of dizziness and syncope and don't stretch or do strenuous exercise. 2. Wound care. Keep the wound clean and dry. Rinse with water after using the toilet and wipe with tissue from front to back. No antiseptic solution is needed. Don't forget to change the sanitary pad frequently. 3. U5. U5 is the traditional Thai postnatal massage that is believed to help relieving pain after birth and gives warmth to the mother. However, this can result in losing too much sweat and causes dehydration, so you should drink a lot of water. 4. Sit and stand. Use the pillow under your seat. Don't sit on haunches because it can make the wound stretch and causes poor wound healing. Normally, the wound would be healed within 7 days. 5. Breastfeeding and breast care. A few days after birth, you might experience firm, tender, and engorged breasts. Frequent breastfeeding on birth breasts is recommended to minimize the engorgement. Remove your baby from your breast correctly by placing your finger in the corner of the baby's mouth, then gently break the suction between the baby's mouth and your breast. Don't pump or remove the milk from your breast, which will cause your breast to produce more milk. Wear bra that fits well and provides good support to reduce pain. Wash your hands before touching your breast. Keep your breasts and nipples clean by washing them daily with warm water in the shower or bath. Use moistened cotton wipe at nipple before and after breastfeeding. Also avoid using soap on your breast because it can cause dry, cracked, and irritated skin. Apply a cold pack to your breast for 15 minutes, then switch to warm pack to reduce pain. 6. Clean up your body. Take a shower daily and wash your hair 2 to 3 times per week. 7. Constipation and hemorrhoid. If you notice pain during bowel movements or feel swelling near your anus, you might have swollen veins in the anus or lower rectum, which is called hemorrhoids. To ease discomfort while the hemorrhoids heal, you can apply an over-the-counter hemorrhoid cream or suppository containing hydrocortisone. Soak your anal area in plain warm water for 10 to 15 minutes, 2 to 3 times a day. If you find yourself avoiding bowel movements out of fear or hurting your perineum or aggravating the pain of the hemorrhoids or your episiotomy wound, take steps to keep your stool soft and regular. Eat foods high in fiber including fruits, vegetables, and whole grain and drink plenty of water. Ask your healthcare provider about a stool softener if needed. 8. Change the pads. After delivery, normally there are lots of low care. The red liquid that passes through vagina after delivery. It would be in 2 to 3 days. You should change the pad frequently or immediately when it's full or every 3 hours for clean. Don't make the pads smell full because episiotomy wound, the incision between vagina and anus, is easily inflamed. Tampon is not recommended to use. 9. Food. We recommend easily digested food and high fiber food to prevent constipation. We also recommend you to avoid spicy food which can easily cause diarrhea. Food after delivery should be considered in the breastfeeding mother. Mothers should balance nutrition across the day by eating all 5 food groups such as fish, meat, liver, milk, egg, fruit, and vegetables. They can repair their body and make them become healthy again and produce good quality of breast milk. Seafood diet is recommended for increasing iodine in breast milk to give more IQ to baby. Drink water at least 6 to 8 glasses per day and before feeding baby. The mother can eat almost all type of food. Avoiding some typical types of food that were said in myths is a wrong idea. For example, eating only rice and salt while avoiding any meats may cause malnutrition, or eating only meats while not having any fruits or vegetable may also cause the baby to lack vitamins and minerals. The mother should avoid alcohol, caffeine, and energy drinks. Also, undercooked, spicy, and pickled food should be avoided. For the medicine or herbs intake, it must be under the doctor's supervision. This is because some types of medicine or herbs could cause medical problems. The mother should avoid high carbs and fatty food, especially animal fat, starch, and sugar. For example, noodles or rice should be consumed at a moderate level, and the mother should try to avoid desserts. This is because these kind of foods causing people to get fat and giving low benefits to a human body. Breastfeeding mothers should be aware of taking a drug without doctor's advices. It is because many drugs, such as antibiotics and sleeping pills, can be passed to the baby through the mother's milk. 10. Postnatal supplements. After delivery, doctor will prescribe only analgesics such as paracetamol or blood builder pills because the postpartum mothers will lose a lot of blood. Thus, they should have multivitamin supplements to replace what they lost and to improve the breast milk quality for the baby. The doctor will prescribe supplements to mother at least for a month and a half or 2 months. If during the postpartum the mother lost a lot of blood, there could be more iron supplements to be prescribed to the mother. 11. Taking a rest. The mother should take a rest for faster recovery. However, the mother may face tiredness on having not enough sleep because they have to take care of the baby crying during the night. If this happens, the mother should try to get a rest while the baby sleeps. Typically, new mothers should get at least an 8-hour sleep per day, and during the day, the mothers should get at least 1 hour of sleep. Nevertheless, the mothers should not sleep while breastfeeding because the big breast can cause the baby to suffocate it and cannot take a breath. 12. Mental care. Mothers should adjust their mental for being a new mother. The most effective supporter is the husband. The husband should take care of the mother physically and mentally, including daily routines and babysitting so the mother could have a time to rest. 13. Sexual intercourse. Mothers should avoid sexual intercourse until 6 weeks postpartum checkup to prevent episiotomy, wound infection, and uterus infection because the logia can increase risk of infection. 14. Menstruation and contraception. Moms who fully breastfed can expect their periods to start returning at around 6 months postpartum. If you don't breastfeed or don't exclusively breastfeed, your period might return 1 to 3 months after giving birth. How effective is the breastfeeding as the birth control? When you do it perfectly, the lactation amenorrhea method, birth control method can be about as effective as hormonal contraception. About 2 of 100 people who use exclusively breastfeeding as birth control get pregnant in 6 months. It can be used after a baby is born. It's important to remember that exclusively breastfeeding can only be used as birth control for this first 6 months of the baby's life or until your period returns. After that, breastfeeding is way less effective, especially as the baby begins to eat solid foods and sleeps longer at night. Be ready to use another birth control method at 6 months when your period returns or if you start feeding your baby food or formula. Postpartum exercise. Core changes during pregnancy and postpartum. As the belly expands, the abdominal stretch and the back muscle shorten. The connective tissue in the linea alba thins and separates. The ligaments and joints in the pelvis become very unstable. The pelvic floor often weakens under the weight of the fetus. How soon after giving birth can you start thinking about exercising again? When it's safe for you to start exercising again depends on how your pregnancy and delivery went. If you had an uncomplicated pregnancy and normal vaginal delivery, you can start doing light exercises as soon as a few days after giving birth. If you experienced a complicated pregnancy or had a cesarean section, your body will likely need more time. Your doctor will help you understand when you can start exercising again. Activities to try. Start with something low impact and simple such as a daily walk. With your health care providers, okay. Also consider these specific exercises. First, pelvic tilt. Try the pelvic tilt a few times a day to strengthen your abdominal muscles. Lie on your back on the floor with your knees bent. Flatten your back against the floor by tightening your abdominal muscle and bending your pelvis up slightly. Hold for about 10 seconds. Repeat 5 times and work up to 10 to 20 repetitions. Second, Kegel exercise. Use this exercise to tone your pelvic floor muscle, which support the uterus, bladder, small intestine, and rectum. When practiced regularly, Kegel exercise can help reduce urinary and anal incontinence. Contract your pelvic floor muscle as if you're attempting to stop urinating midstream. Hold for up to 10 seconds and release, relaxing for 10 seconds between contractions. Aim for at least 3 sets of 10 repetitions a day. Happy baby yoga pose. Your pelvic muscle can tighten and become painful after childbirth. This yoga pose can help relax and gently stretch your muscle to relieve pain. Lie on your back and bring your knees toward your chest. Open your knees slightly wider than your hips, keeping your arms on the inside of your knees. Use your hands to hold on to the outside of your feet or ankles. Bend your knees so that the bottom of your feet face upward and gently pull your feet downward to lower your knees toward the surface. Focus on relaxing your pelvic muscle as you work toward holding this pose for about 90 seconds. 16. Skincare. Top postpartum skin issue. Don't worry too much about your skin's texture or appearance after childbirth. Your body has been through the mill, and the fact that you're not sleeping very much doesn't help at all. In many cases, your skin issue will resolve with the passage of time. Tips to care for your postpartum skin. First, stay out of the sun, or at least minimize potential sun damage by applying a broad spectrum sunscreen that blocks UVA and UVB rays with an SPF of 30 or greater every day. Another option is to switch to a moisturizer or foundation that offers the same level of sun protection. Second, keep it clean. A gentle twice daily cleansing may help prevent blemish. 3. Eat healthy foods. Nutrient-rich foods, including fruits and veggies, whole grains, and healthy fats, can support overall health, including healthy skin. 4. Drink plenty of water. Whether you get it from straight-up tap water, other fluids, or food, your body needs a total of 8 to 12 of 8-ounce cups of water a day when you're pregnant. So, aim for the same amount of water after delivery. 17. Postpartum shake-up. When to see the doctor? A postpartum shake-up was a one-time visit scheduled between 4 and 6 weeks after delivery. 18. Warning sign of health problems after birth. What are warning signs to look after giving birth? First, the fever higher than 38 degrees Celsius. Second, discharge, pain, or redness that doesn't go away or get worse around a C-section cut, episiotomy, or perineal tear. Pain or burning when you urinate, pain in your lower back or side, or needing to pee often. Red streaks on your breast or lump in your breast that are new and hurt. Bleeding that heavier than your normal period, or bleeding that gets worse over time. Changes in vision, dizziness, severe headache, pain in the upper right belly or in the shoulder, trouble breathing, sudden weight gain or swelling in the legs, hand or face, chest pain, coughing, or gasping for air, feeling sad or hopeless for more than 10 days after giving birth.